Up and personal. It's fine. Alright, so I guess we'll start. Hi everyone, thank you for coming today. My name is Barbara Lee. I'm a Drexel MSN student, so I'm working with the clinical nurse education specialists, Tammy Proctor and Angela Ross. This presentation is being recorded. It's my didactic session, so I'd really appreciate your feedback at the end. You guys have your pre-surveys. I'll give you post ones at the end. So this lesson is for all nurses who care for medical patients at risk for developing sepsis. Before I get started, I wanted to make sure that you all signed in to get credit and complete the pre-survey so that we can assess your comfort and confidence in caring for patients with potential sepsis. And then make sure that you've downloaded the Poll Everywhere app. If you download the app and then put my name and 151, it'll ask you to start the survey, and you can press start survey when we actually do the questions. All right. And then I ask that you refrain from using your cell phones unless we're using the app, but if you need to make a phone call or anything, feel free to step out. The bathrooms, well, the one is right outside this door, so if you need to go, you can go. All right. So, like I said, my name is Barbara Lee. To give a little background about myself, I am a pediatric oncology nurse. So, I've worked at the Children's Hospital of Philadelphia for about a little over 7 years. And I worked inpatient oncology and bone marrow transplant, and then moved outpatient where I primarily work with the neuro-oncology patient population. So our clinic serves as the ED for patients during weekdays, business hours, I guess 8 to 6:30, so that they don't have to go to the emergency room. I'm sure you guys know that patients don't like going there when they have cancer because they're here all the time, and sometimes they don't know how to like access ports and everything. The nurses down there, so. So I see a lot of the kids coming in for fevers with central lines. So sepsis is something that I'm familiar with. All right. So the session is going to focus on how to identify sepsis, interpret patient symptoms that lead to a sepsis diagnosis, prioritize care in a patient with sepsis diagnosis, and then assess the outcomes in a patient with a sepsis diagnosis. So I wanted to start off by asking you a question. How many of you know that September is National Sepsis Awareness Month? Very good. So sepsis is, September is National Sepsis Awareness Month. The CDC defines sepsis as a complication caused by the body's overwhelming and life-threatening response to an infection. It can lead to tissue damage, organ failure, and even death. It's difficult to diagnose, and it happens very quickly. And it can be confused with other conditions early on. It's a medical emergency, so time is of the essence. When sepsis is quickly recognized and treated, lives are saved. And although this is true, sometimes the initial signs and symptoms are like non-specific and can lead to a delay in the diagnosis, which leads to delay in care, and then that could lead to bad outcomes. So patients presenting with vague symptoms often are twice as likely to die from their infection or whatever's going on. Do you guys know any of the common symptoms of a patient who may be septic?
Yeah. They have a fever.
Okay, good. Fever.
Hypotension.
Hypotension. Good. Yep. Tachycardia. See right here.
Sorry I'm late, everybody.
This is my professor, Dr. Durstein. She's here.
Hi,
to support
everybody.
me.
Boy, it really took me a while to get through all that mess down there. Anyway, I'm sorry I'm late. Barbara,
okay.
I was delayed in a meeting and I took a cab to get here, so
Oh.
I'd be here fast, so.
No
yeah.
problem.
Okay.
Slide your bag
Oh,
over.
that's
Oh, yeah.
She's recording you. I'll slide it over now.
Oh, that's good.
Sorry.
Thank you. All right, so some of the symptoms that they may present with are malaise, fatigue, shortness of breath, altered mental status is one that's often seen. So it's largely a disease of the elderly population, so people who are over the age of 60. Now I'd like to take a quick poll, and I think this is where the Poll Everywhere comes into play. So if you downloaded the Poll Everywhere app, put in it's Barbara Lee 151. You guys can participate in in the questions. All right. So, what percentage of Americans do you think know what the word sepsis is? And then the answer should pop up once you put it in, hopefully.
Is it a website also?
It's an
Yes.
I think so.
Does it pop up?
It should. Let me see if this is. Now is it working?
It's pollev.com.
Poll Everywhere.
Reloaded.
Oh, 5 responses.
Okay.
Are they coming in?
What's your thing again?
Barbara Lee, BARBARALEE 151, and then you can start taking a survey. Oh, that stinks. Don't worry about it. You can think of the answer in your head or shout them out. That might work.
I said 15.
15, okay.
10.
10.
25.
These are all very low. 25, okay, we're getting closer. So, oh, I don't have those. It's 58% of Americans that actually know what the word sepsis is. Have a little more faith in your Americans or the fellow
No, I don't
peers.
disagree with you.
Oh, no.
But it's funny because there was a physician here yesterday who's part of the Sepsis Alliance for Penn, and he mentions in his presentation how most patients did not know. They polled patients after they went home. They were looking at mortality of patients
Right.
X number of years out after having a sepsis diagnosis, and most people would be like, sepsis, what's that? I didn't have it. So it was like about 10 to 15% of the patients actually knew that their family or loved one actually had sepsis. So
Yeah.
interesting that
Well,
That's
it's
what we talked about. They don't
Yeah.
know that they've had it.
right, but how many? I'm gonna ask another question. Oh, there we go. 58% actually know what the word means or what the word is, and then what percentage do you think knows what the symptoms are?
28.
Okay.
30.
Okay. Dr. D? Well, it's actually less than 1%.
I was gonna say
Numbers.
0.
Yeah. Yeah. People may know what the word means, but they don't actually know what the symptoms are or how to identify it. So, millions of Americans will develop sepsis this year, and more people die from sepsis than prostate cancer, breast cancer, and AIDS combined. So that's a lot. And it contributes to more than half of the deaths that happen at Penn Medicine, which is a lot. Oh,
Yeah.
it's significant, yeah. So how can we as nurses make a difference? I'll tell you.
early recognition,
Yes.
early treatment.
There you go. So early recognition and actually calling it sepsis, like getting the docs on board, is huge, because then the faster you identify it, then the faster the treatments can happen and stuff like that, better outcomes. So early treatment, like I said, and prioritizing care, and we'll be talking about that. Repeated education and raising awareness about sepsis, since not a lot of people know exactly what it is or what can happen from it. And then the follow-up care that we provide for patients after they get discharged. All right. Can anyone tell me a time where you knew something wasn't right with the patient, maybe questioned the providers, and then eventually led to sepsis diagnosis?
I have a situation where I was taking care of a patient and she had like this very subtle change in mental status. I mentioned it to the provider. He kind of did an assessment and kind of was like, no, I don't think anything, significant worth investigating. And then the next day she developed the fever and the symptoms and she was septic.
Wow. Now, how did that make you feel when the doc didn't really agree or like support you in that?
I think it's like I had this hunch and
Uh-huh.
he didn't know the patient. He had just seen the patient that day, so he didn't know like what her baseline. So it was tough
Oh,
because I was
okay.
trying to convince him
Mhm.
and he just wasn't really hearing what I was trying to push for.
Right. Now, do you?
Frustrating.
It
when
is
they don't
frustrating, yeah.
listen, and then bad outcomes.
Right.
You could have prevented something.
Yeah. So, do you think you could have gone up the chain of command or talked to your charge nurse about it to help you, like, kind of get everyone on board or like put this patient on alert? Oh, you were the charge nurse.
The charge nurse.
Well, if you don't know, nursing students, you will know or develop this like gut sense that maybe something isn't right. Come on in, guys. That's okay.
I'm gonna put you on the windowsill, sorry.
Yeah. Come on around this way.
Oh, is it your bad again, Chris?
That's okay.
Thank you.
I got a crowd.
Yes. So I was saying that you guys are nursing students, but as you get experience and like you get to know your patients, you'll develop this sense of like a gut feeling when something isn't right. And if you ever feel that way, just make sure you continue to like fight for your patient and be the patient advocate, because you can save their life if something is happening with the patient. And we're talking about sepsis here, if you didn't already gather. So I want this session and these examples to kind of be like stories just to empower you guys to be advocates for your patients. If you have the gut feeling, just continue to fight for it, because that's what we do as nurses. We are patient advocates. We do save lives, and sepsis is a serious thing that can lead to death. So I said that the CDC defines sepsis as a complication caused by the body's overwhelming and life-threatening response to infection. It is difficult to diagnose, and it's considered a medical emergency, so time is really important. Time to identify and treat and everything is really important. So what exactly are we looking for to identify sepsis? So any patient with a suspected or known infection should be considered for a sepsis diagnosis. Also, if they meet more than or 2 or more of the SIRS criteria or signs of systemic stress, then they should be considered for a sepsis diagnosis. We discussed that signs of sepsis may include tachycardia, hypotension, abnormal temperatures, tachypnea, abnormal leukocyte counts, thrombocytopenia, or elevated lactate levels. All right. So a nice way to remember some of the signs and symptoms is to remember the sepsis acronym. So shivering could mean that they have a fever, or like say that they're really cold. They might not actually have a fever, but it can be just a sign. Extreme pain or discomfort, that could be a sign of something going on, like if they have foot pain, maybe they have an ulcer on their foot. So they might be pale or have discolored skin. That's what hypoxia sometimes causes, a blue discoloration. Shortness of breath, or a patient stating that they feel like they might die. And increased sleepiness, so they might be difficult to arouse, or they might be delirious in the case of Angela's patient. That's what was presenting. All right. So after we identify the signs and symptoms of sepsis, it's really important to get the docs or providers on board with actually declaring and diagnosing the patient with sepsis. And I say that this is extremely important again because it has a big impact on, well, early treatment has a big impact on outcome. So we talked about how it could be frustrating if a provider wasn't on board, so make sure that you use all your resources, charge nurses, other nurses who may be familiar with the patient to try and support your case. So now that we've identified sepsis and the providers have diagnosed the patient with sepsis, what are some interventions for treating a patient with sepsis diagnosis? So like say you see that your patient is confused and may have a fever, what would you do as the nurse? So now we're focusing on nursing care and nursing interventions, so prioritizing care.
So you notify the doctor?
Yes.
And then just anticipate drawing blood cultures, final logs, starting.
Good. Do you, so you know this from experience? Okay. So yes, you draw blood cultures, give antibiotics, give supportive medications. So let's get into all of that. Another acronym you can use to remember the prioritizing your care and which interventions you would do first is remembering the word CAF. It's weird, but maybe it'll help. So you want to draw blood cultures. Maybe you do this while gaining another access with a large core IV. You would draw your culture from there, and then you would administer broad spectrum antibiotics. And this is the main treatment for sepsis, both with and without organ failure and septic shock. Providers should order antibiotics at the time of recognition. And then nurses should administer the antibiotics within 60 minutes of the order. Do you guys have a safety and quality specialist who monitors, or do you nurses monitor fever to antibiotic time as like a nursing quality indicator?
We have a sepsis committee here. Most hospitals have a sepsis committee in the health system that probably do quality on the back end.
Yes. So if you don't,
know.
yeah, if you don't do it, I'm sure it's happening, but it's a good way to indicate your nursing outcomes, which also helps with the magnet recognition. So these are things that you guys are doing in order to improve patient care. So then also the L is for the lactate level, so you'll draw an initial lactate level and then redraw it 2 to 3 hours later if the level is greater than 2. And we'll talk about why that's important later. And then F is for fluids. We'll administer fluids and provide other supportive interventions such as Tylenol, if they need oxygen, maybe some oxygen, and pressors if that's absolutely necessary. Okay. So here's a picture of your antibiotic map. We start with broad spectrum antibiotics, right? And then it's primarily for gram-negative coverage, and then you proceed to the other antibiotics as indicated. So, if you administer cefepime first, would you give Gent or Vanco next? Do you normally administer antibiotics when so what's your normal, like, say the patient is ill appearing. So those are the 3 medications that were ordered by the provider. Do you know off the top of your head? Yes, correct. So the reason that you do Vanc is because Gent is, I think it's an aminoglycoside, and like you have to separate them from the cefepime an hour from the aminoglycoside. So usually in practice, you will know that you give Cef, Vanc, then Gent. Wasn't a trick question. I have no trick questions here. Okay. So let's talk about the lactate. Does anyone know why the lactate is like an important level that we draw? I know you know it. So it correlates with the illness and prognosis during sepsis. So an initial elevated level would indicate or is associated with high mortality rates. And that's why we draw the lactic acid level. So lactate is actually a transportable metabolite in our bodies that is used for energy production. And lactic acidosis occurs because of tissue hypoxia or underlying disease, toxins or drugs, and errors in metabolism. Like I said, we would draw the lactic acid level at the time of when we suspect a sepsis. When we expect that sepsis is happening. So we draw it at the time and then redraw if the level is greater than 2, within 2 to 3 hours. Do you know how to initially treat lactic acidosis? Fluids is one of them. But first is antibiotics. So you would treat initially with antibiotics and then fluids, and then you would pay attention to oxygen and perfusion, so with blood pressure management, so the pressors if necessary. Have you guys seen this sepsis recognition tool? So this is what Penn uses to kind of figure out what's happening with the patient and how to categorize, like if they have organ failure, if it's acute or chronic, and things like that. So it can be overwhelming, so let's dissect it. So sepsis can be identified with or without acute or chronic organ dysfunction. Septic shock is present when sepsis progresses to an acute organ dysfunction and hypoperfusion, tissue hypoperfusion. So on the left, we're talking about diagnosis sepsis without organ dysfunction. So that's your initial, the patient may have an infection, or we know the patient has an infection and they meet more than 2 of those service criteria. So systemic inflammatory response system is what that stands for. In the middle, you have a sepsis diagnosis with acute organ dysfunction where changes may be identified in the different systems that you are assessing. So the CNS, you may have mental status change. In CV, you may notice blood pressure changes or respiratory changes. With perfusion, you'll go back to that lactate level. So it's important to get a baseline when you initially have this, when you're thinking sepsis in a patient. And then respiratory, you may have, I said, changes in the respiratory and creat, coags, and liver function tests. And then over here is the septic shock, where sepsis progresses with organ dysfunction and hypoperfusion. All right. So now that we've identified sepsis, provided the early treatment and prioritized care, we need to provide lots and lots of education for our patients and families, because like we've discovered, less than 1% actually know what sepsis looks like. So we can start with talking about their diagnosis and raising awareness. Infection prevention is something that we would talk about as nurses. So you would educate about good hand hygiene. What do you teach your oncology patients to prevent infection?
Have everyone like wash their hands.
Yes. Good
No one
hand
sick in the room. Yeah.
Right. Good. What about the flu vaccine? I know this is oncology specific, but we have some of that in our group here. So oncology patients on therapy can actually receive the flu vaccination, and we recommend that everybody gets it, especially people in their household. it's not, as long as they don't get the live vaccine. Right. Let's see. What about, you guys see diabetes patients, right? So what would you teach diabetics to prevent infections?
Managing their sugars.
Good. Skincare. Do you always look at their feet? Yeah. If you guys have checkout, make sure you look at their feet. Okay, and then obviously tell them to seek care if they don't feel well, right? All right. So again, specific to oncology, neutropenic sepsis. Do you guys teach your patients who are leaving, say that they had just gotten chemo, what do you teach your patients to look out for while they nadir? Fever, chills.
We tell them to call the office if they have a temperature at least.
Great, so they want to check their temperatures.
If you feel too warm and you don't want to go around sick people,
Good.
you can tell sick people to stay away from you, and go to your family members, and you also tell them that if they're going to eat meat, make sure you cook the meat.
Yes. So in addition to cooking meat, you want to make sure that all of the fruits and vegetables, like the raw fruits and vegetables that they're eating, aren't dirty. Yeah, so make sure that they wash that really well. Have you ever seen patients not come in when they had a fever? Or they like...
We don't want to speak to that. We don't know when they go home. But we see a lot of people coming.
Right.
They have fevers. Yeah, they're coming for the
Right. So sometimes, I mean, this happens a lot in the pediatric world. Like the parents don't bring their kids in because they think they're fine, whether they live far or they don't want to go to their local ED because those people aren't really, well, those nurses aren't like proficient in accessing their ports, so you know the kids are scared and terrified, and it's traumatic for the parents as well. Also, you said avoid crowds. I don't know if anyone, do you teach people not to go around kids who go to daycare?
We tell them that. Yeah, because when kids come over.
Right. So like the kids in daycare like contract everything, right? I recently saw an article saying like to advise people not to kiss their babies because there's a baby in the ICU with RSV and things like that. So you really want to protect the kids and the adults who are neutropenic or susceptible, really at high risk for infection. All right. So if you know that patients like avoid coming in or checking their temperature, you really need to provide that education and reinforcement to be on top of it, because you might not develop a fever, right? So sometimes like a lot of diarrhea or mucositis, those are all sources of infection in the GI tract. And then teach them the signs of sepsis. So hypotension, hypothermia, feeling cold or feeling feverish. If they haven't really peed, so decreased urine output, shortness of breath, and confusion. So I have a slide on common infections that may lead to sepsis. So you can teach your patients pneumonia, lung infections would put you at risk for sepsis. UTIs can lead to a kidney infection. Any gut infections or skin infections, they need to come in and get it checked out so that it doesn't progress to something where they can die. And then teach them again about the sepsis acronym, so shivering, extreme pain, paleness, discoloration of the skin, shortness of breath, I may feel like dying, sleepiness, also clammy or sweaty skin is a sign, confusion and disorientation, and high heart rate. All right, going over the follow-up care. After we've identified sepsis, provided the early treatment, and prioritized care, we want to provide the education to our patients, which we've been already discussing. We need to make sure that they get the proper follow-up care. So 1 in 4 sepsis survivors actually get readmitted to the hospital within 30 days. And it's often with a life-threatening infection, another life-threatening infection. So it's really important to provide the education so that they know what to look out for and when to come in.
All right, bye-bye.
So what are ways that we kind of follow up on with our patients? You guys do this all the time during clinical. You assess the patients, right, when you go in, but what do you physically do with them? You monitor their vital signs. Yeah, so you monitor their vital signs. Nurses, if you obtain a culture, you want to, obviously the providers will do this as well, but follow up and see if anything grew back. That way you can cater the antibiotic to whatever organism that grew back. And then providing the PFEs to these patients and families, so again, they know what they're looking for. When you do discharge teaching with medications, do you do a teach back? Like ask them to tell you how much?
We do.
Yes. So it's really important to make sure that your patients know the dosage, the medication, you know, the 10 rights of medication that there are. And then make sure you hand them a discharge instruction so that they know where to follow up, and the whole summary of everything that they've gone through. All right. So we're gonna go to the poll everywhere again. It should come up, hopefully. We have 5 responses on the first one. Which of the following statements is true? Is not coming up.
Mine came up. I went on the website though,
Oh, you did?
and I just put your full name.
Look at this. Okay.
Is it coming through on your thing?
Yes. Except it's weird. You know what? Here. Let's do it like this. Oh,
Good timeout.
here we go. I can see it on my screen.
Okay.
Sorry this isn't working. We're just gonna roll anyway. Yeah. All right, so sepsis is a local infection such as cellulitis or appendicitis. That's pretty specific, so we'll
Sorry,
move
it's my
on.
lunch.
Sepsis is your body's toxic response to an infection. Sepsis is prevented by taking antibiotics until you feel better. That is true. Something, I mean, not just until you feel better, but until you complete the entire course. And then sepsis is an infection in the blood. So that could be true, but I think it's too specific. So the correct answer is sepsis is your body's toxic response to an infection. That was the CDC's definition. All right. Which of the following patients most likely have sepsis? What do you guys think? A patient who states he's very cold, pale, and asks when his mother will be visiting. She's deceased. Correct. So that's the confused patient. So the first one, although they have a low-grade temperature, they don't meet the other criteria. So they may have a known or suspected infection, but they don't have 2 of the SIRS criteria or systemic stress. Patient with shortness of breath and 6 out of 10 pain after physical therapy session, so that's expected pain, right? And then a patient with a white blood cell count of 1.2, is that normal? It's low, yeah. 5 to 10 is normal, right? A hemoglobin of 10 and platelet count of 100,000. Are those normal?
Say it again.
Hemoglobin of 10, platelet count of 100,000. Right, you're like, meh, they'll be fine. They may have a headache, but probably not.
That's low.
Right, yeah, that's normal. All right.
And it's pretty good for this floor.
Yeah, it's pretty good for this.
Yeah, I was gonna say.
Yeah.
Population out here.
Alright. A lethargic patient with a central venous line has multiple low-grade fevers, nausea, and mouth sores. Vital signs are as follows. Temperature, do you guys do Celsius or Fahrenheit? Alright, so Celsius, that temperature is considered a low-grade temperature. Keep that in mind. 38.4. A respiration rate of 28, heart rate of 120, blood pressure 81/45, and a pulse ox of 96. What would you as the nurse do? Would you obtain another set of vital signs? Maybe.
Doesn't hurt.
Right, it doesn't hurt. So maybe the answer, maybe not. Explains concerns to the patient's family member. Sure, but not a priority, right? We're prioritizing care here. Administer broad spectrum antibiotics or draw blood cultures. Yes, that's right. So you always, I mean, I'll be honest and say that I made the mistake of accidentally giving the antibiotics before drawing blood cultures. Because you're like in the zone and you're like thinking other people are there to help you and doing, helping you with the care. So what's the acronym that we use to prioritize care?
Yeah.
Yeah. Very good. All right, here we go again. We're prioritizing care. Can you guys all see that? Let me know what you think. 1, 2, or 3. Just hold your fingers up.
Yeah. It's the second one.
Tell me again.
The second one.
We're doing the third one because CAF, remember? C is culture. A, O. You know what? It's CAF. Sorry, it's the second one. Draw blood culture, administer cefepime, lactic acid, and then fluids. CAF. I mean, I feel like in nursing care, you would draw the cultures and draw the lactic acid.
Yeah.
So
And then administer it.
I think what I was going for with this question was CAF, but in nursing care, not everything goes to, as you would in
Yeah, I feel
textbook.
like we do fluids first because we're waiting for antibiotics from pharmacy.
Yeah,
Like we don't have it readily available, so we start our boluses.
Because, in sepsis, there's profound,
Hypotension, yeah.
So, number one treatment is fluids. Then antibiotics.
Yeah.
Don't you want to relax before you do that?
Not necessarily. So antibiotics, remember, it's important to give the antibiotics as close to the identification of the fever or whatever sepsis diagnosis, right? And this is just another statement. It clearly shows that textbook isn't everything, and while you cluster care or do everything in the best way that you can for your flow in your nursing care, it's not going to be what it says in the textbook. So yes, CAF, remember that, but you also want to cluster care, draw your blood cultures and lactic acid levels. You can start your fluids before you actually give your antibiotics because it might not be available. So thank you. Because you're right, I don't do it in my practice. I mean, that's how I would do it. As you get better and more proficient in the care that you provide, you'll have your own flow, and like you'll have people to help you in managing that patient. All right. Which of the following statement best suggests that a patient understands sepsis? So this is what is the best answer? Here we go again, nursing school. The answers might be right, but we want to choose the best one. So for you guys who can't see, I will take Tylenol for future foot ulcer pain and temperature of 100.5 degrees Fahrenheit. I will eat 3 meals a day and exercise regularly to rebuild my strength. Maybe. I will stay away from sick people and call for help if I'm feeling ill. Okay, and I will regularly visit my primary care provider. Which is the best answer?
3.
Yeah. So 3, I will stay away from sick people. That is the best answer. We do want to tell patients to, you know, eat their 3 meals a day, and snack, you know, be healthy, and also visit their primary care provider regularly. So here is a list of resources for staff members. You can access this on the intranet here at Penn, and then you would click on the Sepsis Alliance website or link on the website, and you can hit the toolkits and find PFEs and micro-learnings. So the PFEs, do you guys know what that stands for? PFEs are patient family education. So I've seen flyers over here. They're on a wall with like different pockets. Those are considered PFEs for patients. So like, say a patient does have sepsis and is getting discharged, you can grab and go with that sepsis PFE and hand it to the patient so that they have all the information they need. And you want to do this because you may talk with patients and like talk to them about their signs and symptoms of everything, but it may go in one ear and out the other because they're so excited to go home, right? So you want to make sure that you provide everything you can for that patient to make them successful and be healthy at home. Take home points. I've ingrained this and said this over and over again, and I'll say it again. So the way that we can increase, you know, awareness of sepsis and treat them and have better outcomes in the hospital is early identification and calling it sepsis, getting the providers involved and on board with identifying and diagnosing the patients with having sepsis.
I think we have those systems in the computer here. Once you plug in certain numbers, you trigger like a sepsis alarm.
Oh, very good.
Like you do vital signs, blood pressure is very low, temperature stays, this heart rate, and it just triggers it.
That's really great. So then they have in real time, like their vital signs, which is so important to document in real time. It's hard, but that's why we say that. And then provide all that education and make sure that they get the follow-up care that they need. Do you guys have any questions? All right, so these are the resources. Angela can post them on the shared drive.
Yeah, are you able to pull up the internet? One of the biggest challenges, so I'm on the system-wide sepsis committee, and I think one of our biggest challenges is our patients have so many comorbidities, so when they're being discharged with a diagnosis of cancer, a lot of people have secondary diagnoses of sepsis, so it's not always captured and it isn't always communicated to the patients that they've had sepsis. So our goal is to really provide them a lot of upfront education so when they go home they have the resources, because so many of those patients do come back. It's almost like our heart failure patients, they're readmitted frequently. So there's a really big initiative on making sure that they have resources. So on the internet, under the Sepsis Alliance, here, there's a whole slew of information. So if you do have a patient that it may not be active on there, but you know they've had sepsis on the admission for discharge, you would go to these resources right here, and it's patient and family education. And there's actually sheets that you send home with them that are really descriptive of like what they should look for and those kinds of things. So those are the things we're trying to add to our discharge for them, but they don't always come through because it hasn't been labeled as a problem by the providers. So that's where we're kind of trying to drive the education.
Yeah, so it has here the signs and symptoms, way to prevent it. Again, time matters, and then the life after sepsis. So the issues that may arise after being diagnosed or going through sepsis treatment. So in your downtime, if you have any, you can go and look at the PFEs that you may want to provide. Do you have any questions? All right. So thanks for coming. I actually have a post survey after the presentation. So it's gonna be this Likert scale: strongly disagree to strongly agree. It says disagree, but it's meant to say agree. Do you want one? Yeah.
Catch that, Barbara.
What?
I didn't catch it when I looked at it.
Oh, I know. Me neither.
Strongly disagree. You better have everybody put that out right now.
Sure thing. Just cross out the disc.
Yeah.
And then I'll.
Yeah. If
You guys
didn't
can
sign
leave
in,
it.
Please sign in. You're welcome to take some snacks to go.